the objectives of this study is about actually monitoring the health with the IoT, Internet of Things. So two big objectives to allow to first to researchers to have a tool to monitor and to gather data from the body, and then to allow people to monitor themselves or their families. So that will be the summary for today. First, an introduction and a systematic literature review I have done, the methodology. I will show the results, and we can discuss about these results, and then I conclude and show the references. So as an introduction, in the recent years, Internet of Things, or IoT, is studied as a network of connected devices to interact one with another, and they are supposed to be connected through internet. It plays an important role enabling automation in many fields, such as health, healthcare, or medical health. So yes, actually we are studying this subject in health monitoring. So IoT will be used in health monitoring. We also call it HIoT, which means health IoT. So technologically, it consists of networks such as wireless body area networks, WBANs, or wireless sensor networks, WSNs, which is more about environment. Actually, this is more about body. This is more about environment sensors, and there are other sensors that use RFID, radio frequency identifications, to transfer the obtained data to the cloud for analyzing and extracting meaningful informations. So the architecture, general architecture of IoT in healthcare can be presented like this. It goes on 4 layers. First, the perception layer. This is the layer where the data is gathered, either from the environment or from the body. So we can have wearable sensors or environmental sensors. We use either 5G on the IoT, or we can use a connection of a smartphone, right? So in the second layer, network layer, the data can be transferred to the processing sensors. So this can be basically the cloud. You can see here it's represented by this scheme, and DB means database. So the engine can then process the data and extract meaningful information that can allow the health centers or health professionals to intervene. So the application and business layer is where professionals can intervene. Now, actually, we can focus on this in this layer. This is where my study is done. So this layer can be explained as this. So we can have, this is like an object. Actually, it can be a band, smart band or smartwatch. We can gather many type of informations, then process it, and give us outputs as alerts or autonomous actions to regulate the brain, and we can also monitor the patient with actions like MCQ, assistance breathing, some individual actions that can regulate the body. So as you can see, this is both for monitoring and also for regulation, actually. So the study explore those two axes, and then we can have the feedback and make the engine learn, actually, individually, and to have personalized advices. So we can also have cognitive inputs that would be another phases of the projects. For now, we just focus on physiological data, because in the market there are small brain bands that can gather cognitive data, like electrical activity of the brain, etc. And then here in green, you can see the feedback. So that means the engine have decided that it has to send a feedback like vibration or some exercises to ask the subject how many counts have you sensed in any each hand, for example. So this one also is for to have a feedback, and also to train the subject like to be in the body, and it's like a good exercise for overthinking. As a literature review, actually, I have based this on this systematic review, systematic literature review, SLR, and other 50 plus articles. Then actually I have studied the words most used in this SLR. It's mainly Internet of Things, healthcare, e-health, systematic review, because actually it also uses other systematic reviews. And you can see that the authors have focused on the security, data, HIoT, privacy, and applications, etc. But security is both can present both an issue and a challenge for the development of HIoT, health IoT. So there are many approaches on the literature. There are mainly 5. So sensor-based, studied the sensors; resource-based, resources, memory, battery, etc. Communication-based, it's about protocols; application-based, it's about monitoring and recommendation. And into monitoring, we can have prediction systems, like it can predict some disease, detection, like the fall detection, and care support systems, which can actually monitor the patients and send, for example, the healthcare team. So my study is more focused on application-based approach. There's also a security-based approach, which is more focused on privacy, access control, etc. So there are many papers that focus just on security. So this is a big issue in this the development of these type of devices. Now the methodology, actually, I have, as I said, focused on application approaches. I have also developed with some colleagues. We have started the development of a Xiaomi-based application. And then we will also study the AI, artificial intelligence, to adapt to individuals. So this is basically my view, general view of this study. Then about the results. So actually, we first have used, we have developed a collaboration with Huawei, but the system seems to be not possible to use. Actually, there's some secret keys we haven't been provided with, so it was impossible to get into the system. So we have tried with the Xiaomi. This is the Xiaomi band, and you can find a complete list of exploitable smart bands on freemyband.com, because actually all the bands are not exploitable. So this is in there's authorization key. If you don't have it, you cannot interact with the band. I mean, from a sense point of view of a developer, you cannot exploit it. You can just be a user. But for ourselves, we have to get into the system to remote control it, actually, and not to have the application to use it. So we have to use it as a seamless device, regardless of the brand or the application you have to install. So actually, you can see a demo here. I have done online demo of heart rate remote monitoring with the Mi Band 5, the 5. So you can online get this data. Actually, every 10 seconds it gives you the heart rate. So this is the heart rate. As for the temperature and the SpO2, this is just decorative. The Mi Band 5 or 6 just gives you the heart rate, nothing else. The 6 and 7 gives you also the oximetry. So this shows that we have been able to remote access the band. That can be in another country, and you can get the data. So actually, the future trends are shown here. We can, for example, have a blockchain to secure the communication between the devices, quality of service, big data analytics, etc. Main challenges are about scalability, how to go onto a bigger scale, to use bigger nodes. Interoperability, as I said, for example, Apple Watch doesn't allow you to access the data unless you have an iPhone. The mobility, so we have to be able to monitor patients regardless where they are localized, and real test bed environment. So for all the studies on the SLR, just 24% are real test bed. So the rest is just simulation. As for the issues, a big issue is about trust and privacy. We have to have systems that focus on trust and privacy. Power management, it's a big issue. So the autonomy is just about 3 days up to 2 weeks, which is very low. We have to also think about autonomous recharging. Other issues are about fog computing, resource management. Resource also include memory and memory optimization, and multi-objective optimization. So to conclude, I have actually studied the SLR, and I have focused on application-based approach. I have done this application, which is a good start, but I have to make it more more practical without to actually to be able to make it run without any bugs, and maybe to allow people to access it remotely. For example, my data or the data of a dog or something, or I mean, or another animal, just to show in real time actually. And I have made some contacts to submit some papers with other professionals like a physician and other researchers in the same area. And this is a glimpse of actually the references I've used for this study. Thank you for your attention.